as you see, you can be a good scientist, but also in order to be sustainable, as I mentioned in the criteria, you try also to apply it. And in order to apply it, you need entrepreneurship spirit, but also intrapreneurship, as he mentioned there, because you could be an entrepreneur, set up a company, but at the same time, you could be part of a big company and be intrapreneur. That means you create new things even within a big corporation. That's why this is one of my favorite subjects that he used to present. So, again, we are starting from batteries that helps sustainability in many directions. Then we came to the how these ideas from academic research can be transferred to the practice. Sure, not necessarily all academic discoveries can be applied immediately. They can be applied in 10 years, can be applied in 20 years. That's fine, there's nothing wrong with that. But in order to be sustainable, we try to apply it as soon as possible in order to serve the needs, the current needs of the people. And as you remember, I mentioned that developing society is one of the criteria of sustainability, developing the quality of human life. I mentioned there, if you forget about this, we are not sustainable. Why? Because a miserable human being will not care for anything. Okay? So, and then you see today, okay, I'm not going too much in details, but say, okay, we don't have enough water. And what they say, the solution is to have a shower once in a month. Okay? So this is a government solution without science in it. That's why the next presentation coming here, it is about oxidative stress. That improves the quality of human life. Now the humans are living longer and longer. By the way, tomorrow at this stage, it will be Professor Rudy Marcus. Last July, he became 100 years old. He still has students and still working, and he will be presenting here, on Zoom, 100 years and 3 months. Okay? So he will be here with us at this stage tomorrow. Why I mention this? Because the product of Professor Inufusa, Professor Haruhiko Inufusa, serves to this direction, improving the quality of human life through managing the oxidative stress. Oxidative stress management today is one of the areas with huge opportunities. Before going to further on explaining, I gave the context, and I invite Professor Inufusa on stage to speak about this. So please.
Good morning, ladies and gentlemen. Thank you very much for the Florian to give me a chance to talk here. Today I will talk about that new era of oxidative stress management for preventing and curing disease. Last night, we had a nice show of the dancing, and this amazing dancer said at first, prevention disease is very important for the sustainability of our life. Yes, of course. And then I would like to thank and appreciate to that Professor Ferid Murad. This photo is SIPS 2019. He came to my symposiums and then talked a little bit. And then what he found is nitroglycerins release that the nitric oxide, NOx, this is the oxidative stress substance, and then losing that muscles and to improve that angina attacks. And then many science and then the research was started from his foundings. As you know that if you cut the apple and then stay there, oxidization starts and then the color changes. And then this is, lasting. That meaning is oxidative stress changing. Same thing will be happen in your body. And then oxidative stress started that from oxygen, we aspirate, and then 2% of not used oxygen was quickly changing to that nitrate radicals. And then nitrate radical is very dangerous for our, bodies. And we call here is a reactive oxygen species, ROSs. Quickly change it to that many substances. And what that cause is inflammations and cancers, some dementia, and arteriosclerosis, brain ischemia, hypertension, tissue injury. And then, as you know, all these connect to that over 100 disease. And but you cannot imagine that what's going to be happening in our bodies. So I would like to show that the typical final product of oxidative stress. One is hydrogen peroxide. This is used for that cross washing. And then another one is hypochlorous acid. This is to disinfections or odor, cleaning the odors. And then these two final products is in our body, and that act for that in our immune cells, like neutrophils. And then the neutrophil found that bacteria and the virus, and then it's eat, phagocyte, but cannot destroy. They use that enzyme and then hydrogen peroxide, hypochlorous acid. And then that meaning is this oxidative stress is basically protect our bodies. But if you think that hydrogen peroxide increasing in your blood, that meaning is whole your body come to inflammations. And then problem of pharmaceutical products. Pharmaceutical product is used after only diagnosis, not before. That meaning is cannot use for the preventions. And then in the worldwide, pharmaceutical regulation is single materials only authorized. That means a single chemical, single enzyme, single protein, something like that. So that multiple composition is not authorized as a pharmaceutical product. I invented 20X, which contains 8 ingredients. As you see that this is really ordinary vitamins, coenzyme Q10, and amino acid. That's it. And then I got, sorry, wording was changing, but I have over 10 patents with this composition because it has a very strong antioxidant effect, and then also many effects. And then I did that safety test. This is a supplement. It is not required for the supplement, but it is very important because of the too much strong effects. So this is a normal human blood, and then data shows that hydrogen peroxide. After 2 to 4 weeks taking the 20X, 30% decrease of that hydrogen peroxide. This data is amazing. Many scientists using that branched amino acid or other things, but it's only 7% decrease after 6 months usage. So this is a case of that Alzheimer's disease, dementia. Many people misunderstanding the amyloid beta is the only cause of that Alzheimer's disease. But the fact is, there is several disease, hypertension, diabetes, and acute stroke, and small vessel disease. All these causing the oxidative stress. And then oxidative stress cause inflammation, and then produce amyloid beta accumulation, and then the Alzheimer's started. And then this circle going round, dementia, go severe conditions. So this is mice data of Alzheimer's disease, and then this data coming from that Okayama University, and then 20x administration reduces amyloid beta. And then in the brain, oxidative stress parameter, and then inflammation parameter is dramatically going down. And then this is a clinical result was published 4 years ago in Journals of Alzheimer's Disease, that the data shows 20x increased that memories, actings. This is MMSE score. And usually that this score is going down, but 20x increased the score. That meaning is not preventing the dementia, but also curing the dementia conditions. This is the first publications, and then this has a real impact in the pharmaceuticals industry area as well. Recently, we published why does the antioxidant complex 20X prevent dementia, and I want to show some data. And then this is ICDD data of France, and they're using cells to checking that oxidative stress and SOD. SOD is superoxide demostase, which acting that the antioxidant. And then as you see, the 20x reducing that ROS, mitochondria, and then cellular, and then increasing that the SOD dramatically 147%. And at this point, this data was 2014, and then CEO of this company told me that the 20X is the most effective anti-ROS without side effect. And then this is a metabolome analysis. This is activity of the metabolisms. As you see that left-hand side is almost green, and then right-hand side is the 20X added, and then red color is really increasing. And then the increasing area is energy production of the mitochondria. So that meaning is if you take that 20X, your mitochondria creating more energy. And this is neogenesis nerves in the hippocampal dentate greased by the 20X administrations, and our brain producing the new brain cells every day at age 6 weeks, like age 20, and one area shows 30 new production cells, but after that 56 weeks, just is like age 60 or 70 of humans, it decreased to that 2/3. But long time administration of the 20X still keeping that neogenesis cells as like we are engaged. So this meaning is if you keep taking the 20x, your your brain producing the new cells. And this is a telomere. Maybe you know well about that. The telomere is lifetime, kind of lifetime. And then the telomere is decreasing. Telomere length is decreasing by the oxidative stress. And this is a diabetes mice. And then it's on the control. And the 20x administration, 38 weeks, increasing the telomere length. That meaning is there is a possibility your lifetime will be prolonged. And this data is, diabetic mice, and then normal control is just normal mice. And then the control shows that the diabetic mice. As you see, this shows hydrogen peroxide levels, and then it is significantly increased by diabetes because of that high sugar, high glucose in your blood, increasing that oxidative stress, and then 20x administrations reducing that oxidative stress. And then autophagy. Autophagy is a cleaning system in your bodies, and then very important in Alzheimer's disease. And in diabetic mice, this control red line shows autophagy band is almost gone, not remaining. But 20x administration group still keeping at some autophagy band. That meaning is if you keep taking the 20x, your cleaning system will remain to working. So that effect of the 20x on Alzheimer's disease, not only amyloid beta, but also strong antioxidant, increase SOD, increase energy production, and reduce blood glucose, decrease insulins, increase neogenesis of neuron in brain, retention autophagy, and prolonged telomere. I strongly believe all these effects worked for that dementia prevention. And I would like to show some more data for that some allergic atopic dermatitis is a big problem in young children because they cannot study too much itchiness. And then you see this circle graph shows how many days patients suffers. So you see that 20x 2 weeks usage and then 20x 4 weeks usage. As you see that patient every day suffers 66%, it's reduced in the half. And then no itchiness or is increasing, and then the patient have a good life. Next slide shows attack numbers of asthma. Asthma attack is also induced by oxidative stress, and then in this cases, patient had a 4 months treatment of 20x, and then as you see, that past 4 months periods, attacks number shows over 11 times 36, decreased to that 14%. As you see that never had the attack was increasing to 60%. Easily understanding that all 95% of patients had effect for no attacks. And then I would like to show some little bit about the COVID. Since COVID-19 infection produce lots of oxidative stress. as you see that ROS, and then this ROS causes that the cytokine storms, blood coagulation, and lots of syndromes. Not virus itself attacks your organs. Oxidative stress from the COVID attacks your organs. And then this is published last year, and I gifted the 20X to the patient suffers. This one is a COVID vaccine side effect. COVID vaccines also producing that lots of ROS and have the same problems. And then, as you see, here is the symptoms: fatigue, breathing difficulty, chest pain, smell and taste disorders, headache, brain fog, and joint pain and dizziness. You see, this is a severe patient decreased by that 20X administrations. This is only 4 weeks administration. This is the questioning monitors. And then at the same time, I monitored that long COVID. Long COVID is still a problem in worldwide. For example, United States will be starting that over 100 million funding to research to find that therapy for that long COVID. And then this is also monitoring questionnaires, and then same parameter as vaccine side effects. As you see that all parameters shows significantly decreased by 20X administration. This is also only 4 weeks administrations. And then after the 20X, we try to improve that product. And then we invented the 20MT, 20-meter control. And we added that other 7 ingredient, and pantothenic acid, thiamine, vitamin B6, folate, biotin, and then lactoferrins. And then also, many people misunderstanding, if you take that supplement, as many as, that's more effective. That's wrong. Because we invented this additional 7 ingredient to the 20M, that is less than 2% of that original 20X. So of course, we did the 5%, 10%, 20%, but effect is going down. So that the combination of that antioxidant with minimal is very important. And then as you see that the chronic fatigue syndrome, there is no drugs, no treatment, and many patients suffers. And then this is also monitoring questionnaires, and 23 patients was joined. And then this is also 4 weeks administration of the 20M, 20-meter control. As you see, the patient suffers it's a daily, fatigueness, and before and after, you see that the point was really decreasing. Okay, and then chronic fatigue syndrome patients have usually sleep disorders. It's a big problem. Okay, and then this parameters also high score is reducing. That meaning is chronic fatigue syndrome is also oxidative stress disease. Okay, so management oxidative stress directly connect to that prevent and cure disease. Thank you very much for your listening.
Thank you, Professor Inufusa. So you see, we have a symposium dedicated to oxidative stress. I think it is in Dreams 1 in this room. It is for 3 days. It's very popular. And Professor Inufusa will describe in detail their successes in managing the oxidative stress. It's one of the major topics today, and with a lot of perspectives, and he achieved very good results. I was not actually joking yesterday, he didn't mention it, but I said that we have to be sustainable, we have to enjoy and drink there, but we have to be here at 8 o'clock. And I see most of you are sustainable, you are here. But also I said that if you drink too much and you feel bad, we have an antidote. And one of the inventions of Professor Inufusa, it is exactly a new Japanese natural product that it can decrease by 50% your alcohol in the body if you drink too much.
Thank you very much. Appreciate it.
I'm serious, I'm not joking. Thank you.